All right, everyone. Thank you for joining, and good to see folks in person as well as welcoming those who are joining on Zoom. I'm Nina Maestera, and London Breedlove and I are co-chairs for the Grand Rounds series. I want to send my thanks to the Grand Rounds Committee, to our IT support, to our administrative support, and also for your engagement and feedback and participation in our series. So thank you all so much. A reminder that our CME process is new. There's a texting function. I'm hearing there may be some issue with this, so please let us know if you're having trouble. I will be giving that feedback to the CME department, so we'll also be working on that if there's an issue. We are also, as our embarking on our second year, have a committee that we're developing and are in the moment kind of developing new ideas and speakers. So also please send any ideas, thoughts, feedback on what you'd like to see or how you feel this series has been going so far. As a reminder, use the chat, please, for any questions, feedback, tech issues. We will do our best to stay mic'd while in the room so that everyone on Zoom can hear the questions and comments. With that, I would like to introduce our speaker for today, Dr. Debra Bell, who's an assistant clinical professor in the Department of Family Medicine. With 35 years of experience, she developed and sustained her interest in integrative medicine at Brown as an undergrad and then at UCSF Medical School. She has a practice at the Osher Center for Integrative Medicine at Ballard, as well as other teaching activities. So want to welcome Dr. Bell. Thank you so much.
There we go. Hello, everyone in Zoom. So the primary title today is, oh, and by the way, I also, for those of you who don't know, I think probably the people in the room know, I also do integrative primary care here at Northgate, as well as doing my consult practices at Ballard. So I am really passionate about how can anybody use some of the lens and modalities of integrative medicine within primary care, even if you are not someone who is a integrative medicine expert? And so that is the focus of my talk today, and I'm going to use the topic of mental health to demonstrate some of that. Did that work? No. Oh, wait, this way. There we go. So there are our objectives. I'm going to be trying to use my presenter view on this, which I don't have to read to you. So let's start with a definition of integrative medicine. And this will be one of the first slides, or the only slides, hopefully, where I'm actually reading to you. But I think that it's easier to take it in if you hear it than if you try and read it. And this is adapted from the University of Arizona Integrative Medicine, which was really one of the pioneers for creating an integrative medicine program within an academic center. So integrative medicine focuses on the whole person, addressing all factors that affect health. It is a holistic approach that takes body, mind, and spirit into account. Practitioners integrate conventional medicine with natural therapies. While conventional medicine largely focuses on symptoms and treatment of disease, integrative medicine is oriented towards healing. It recognizes that each patient has unique needs, and the patient and practitioner partner to seek health and healing. So what is integrative medicine? Again, we're actually coordinating these different modalities of conventional medicine and other modalities that are not part of conventional medicine, some from ancient wisdom. And the word complementary has been used, but the beauty of integrative medicine is that it's not either or, it's coordinated. Again, the idea of it being healing oriented versus creating it, acquiring a diagnosis and finding a medication for treatment is really important. And integrative medicine, there are many disciplines. We often work as a team. So it's a pretty broad field, and so most of us are not doing everything in that. So just to, again, think about why integrative medicine, if we look at what impact medical treatment has on health, it's only about 15 to 20%. And there are all of these other components that have a major impact on health, and particularly chronic disease, both from a prevention and treatment perspective. And so we often use lifestyle. There's now a whole field of lifestyle medicine, and then integrative medicine would include other things as well. And so in integrative medicine, we are trying to address this whole picture. So this other 80 to 85% of where health comes from, we're hoping to address as well. I do want to say a little something about evidence and evidence base here. I think that this is applicable to all medicine and not just integrative medicine, that we tend to have this view that evidence base is what we do. But even in conventional medicine, because we don't know that everything about the science of the human being, that we think we have evidence base, and then suddenly 5 or 10 years later, we're like, oh, well, now we have this new information, so maybe this isn't how we're going to apply this thing. So I think that we have to really consider what do we mean by evidence or evidence-based. And in integrative medicine, we have some obstacles. A big one is funding. The figure that I have been told, and it's probably even more now, is that most drugs are funded about $200 million of research for one drug before it's used. And the NIH Center for Integrative Health has about a $200 million budget for all of integrative medicine for research. So that's pretty small. And because most of the modalities of integrative medicine are not something that are going to make big pharma a lot of money, there is not a lot of outside funding for doing research. So that's one big obstacle. The other is that because of this, the sample size in the studies that we have can be small. So you'll see that I will be quoting a number of meta-analysis, because we often have to take a lot of these small studies together to get really valid information. The other issue, and this will come up when I talk about fish oil in a little while, is that there are that a lot of studies are just not well done. People are in variable states of health, or they're talking about preventing something where the purpose is actually, are we going to treat it versus vice versa? So if we're talking about prevention and you have people who already have really significant disease, what's the degree of their disease? That's going to skew our results. And then also, particularly if you're looking at supplements, what's the quality of the product? What are the doses that are used, et cetera? And so we get all this variability, which can lead us to inconclusiveness. And sometimes then in conventional medicine, that is concluded as it doesn't work. So what we often say in integrative medicine is that we are evidence informed. And so that we're trying to always go by the message of first do no harm, which I would say I would include exorbitant out-of-pocket costs, and that sometimes people get into a road of a lot of out-of-pocket costs for alternative things that maybe is not in their best interest. But also that even if we don't have the kind of evidence-based idea, is there evidence and is there a problem, or is there going to be harm in this by suggesting this to the person? But with this in mind, I am including references for all of the things that I'm going to talk about. And I'm not going to go into detail of the studies because what I really want to do is have this be much more of a practical presentation for you about giving you a view of how one might look at certain things from an integrative perspective, and also possibly some pearls that you might find that you use in your own practice at some point. So why pick mental health? Well, as we all know, it's a really big problem. And so this is sort of looking at the 20 to 30%, but our own University of Washington Institute for Health Metrics and Evaluation in 2019 stated that nearly half of the population, around 44+%, will experience at least one episode of a mental disorder during their lifetime. And we know that depression can be a leading cause of disability around the world. JAMA put a whole article out about the impact of depression and anxiety being the most common health condition worldwide. So helpful for us to look at what are the various things that we might do for that. So again, why bother with integrative medicine? Well, again, we have this high prevalence. And then the two main focus of treatment in conventional medicine for depression and anxiety and mental health issues are medications and psychotherapy. And we have a lot of evidence that people drop out of taking their antidepressants for a variety of reasons. There's cultural stigma, there's adverse effects, and also sometimes the antidepressants don't work. They only work about half of the time. And we also know that there are all of these modifiable other risk factors which may be amenable to change that may have a very positive impact on supporting people. Okay. And so here's a statement regarding that, which is like, what is going on? And so we know that there are many aspects about modern populations that create patterns that actually have a negative impact on our general health and definitely then affect the incidence of depression, right? We are overfed, malnourished by foods that are not healthy. We've become more sedentary. We're spending time inside. We work too much and we don't sleep. And there's social isolation, which of course in the last few years has increased even more with the pandemic. So keep my notes going here. So these are the four things that I'm going to address today about what is the impact that they might have on depression and anxiety and mental health. So for exercise, CDC says that this is the most important thing to do for your health. And there are a multitude of studies that show that exercise improves symptoms of depression. We know physiologically that exercise is correlated with an increase in neurotransmitters and decreasing stress response, helping to reclaim healthy circadian rhythms of cortisol. And then there's also some other aspects of our general health, self-esteem, and by creating those things, a reduced risk of relapse. And what's important about this from a practical perspective is we know that if a practitioner gives someone an actual prescription for exercise, they are more likely to consider it at some point. And just saying you should exercise more is not effective. And so we have to keep this is the individualized view from integrative medicine, is where is the person at? And sometimes I even say to people, well, what if you stepped outside and walked around your house once a day? Or hopefully you all know about motivational interviewing, and you actually ask somebody, what are your obstacles for being more active? What would it take for you to exercise regularly? And so that takes about 2 minutes, and then you can write in the AVS what together you've decided is what the person is going to do to gradually increase their exercise. And so if we look at what the evidence tells us, how much exercise are we actually hoping to get? probably aerobic activity is a little better than weight bearing, resistance training, but any exercise has an effect as an antidepressant. And again, ideally 30 to 40 minutes. There was a study that looked at women cycling, and they had light, moderate, and hard in terms of how hard they were exercising and how long they were exercising. And they all showed efficacy, with the lowest amount of time, I think, being 10 minutes. Any exercise is better than nothing. I think that what's very important to look at is the response rate. So we are getting a 40–50% response rate just from exercise, which again, that's about what we're hoping for an antidepressant, right? And so then there's data that show that exercise can also be used as an adjunct therapy to your antidepressant. So when we think about, well, what are we going to do first, or what's our important, is that if you're thinking about prescribing an antidepressant, maybe have a discussion with the person about their physical activity. And the CDC says even one session of moderate to vigorous physical exercise reduces anxiety. So it really makes a huge, huge difference. And we can have a positive impact with our patients for that. All right, move on to nutrition. And some of this, I'm going to start with the basics. And I'm starting with the basics because I know some things have changed a little, but I also know that the degree of information that we get in medical training about nutrition is tiny. So I don't want to be talking down to you, and I don't want to bore you with things you might already know, but I am going to start with the basics. So we have macronutrients, which are basic foods, micronutrients, which are the vitamins and things that come from our food, what our style of eating is, and making sure that the person doesn't have a nutritional deficiency. So first of all, we're starting off with the standard American diet, which in integrative medicine we call SAD. What's important to look at is, I found this stunning. This first piece of information I actually got from a colleague of mine who's an integrative nutritionist who I worked with for many years when I was in Minnesota. And her data, I don't know where she got it from, but it is evidence data, is that refined grains have all of these lost deficiencies. I mean, basically, it's like way more than half. It's like almost no nutrients in this would be our standard white flour. And we also know that simple sugars correlate with the rates of depression. So in certain populations, so for instance, low-income families who are more exposed to the standard American diet pattern because of food deserts and because that form of food is subsidized, so it ends up being less expensive, have more health problems and more depression. And obviously, it's multifactorial for people who are low income, but their access to healthy nutrition is a component. This one study showed that after 1 week of reducing simple sugars in a person's diet, their depression symptoms decreased substantially, and that when they went back to their diet, they relapsed. So it matters. And then in general, that people who have a diet of processed foods, refined grains, sugar, artificial additives, not a lot of fruits and vegetables, is associated with an increased risk of depression in people who are otherwise healthy. So there is a correlation. So what are the macronutrients? There they are. The protein, which is our building blocks, fats, which are important for cell membranes and communication between cells, and the complex carbohydrates, which are very important for neurotransmitter synthesis. And I have a problem with people eating absolutely no grains over long periods of time because they get depressed because they don't have what they need to make their neurotransmitters. So I'm not a big keto diet fan for long-term use. So what are the healthy macronutrients we might eat for mood? In general, plant-based proteins, seafood, white meat, poultry. For carbohydrates, again, the whole grains, and then our healthy fats. And specifically for trying to support serotonin for someone, that would be someone who is highly anxious and depressed. Tryptophan, which I'm going to be talking about some metabolites of that when we talk about supplements, is needed to create serotonin. And we have tryptophan-rich foods, which would be turkey, anything that is soybeans or milk. And soy gets a bad rap in America, trendiness, because we have created so much processed soy. But in fact, whole, and I usually like to say organic because some of the soybeans and soybean products that are not organic have a lot of chemicals in them. But whole organic soy products, meaning that we haven't changed the content of the soybeans, so tofu, miso, edamame, all of those kinds of things, are incredibly healthy if you don't have a soy sensitivity. So when people say soy is bad, it doesn't increase your estrogen and it doesn't do bad things if it is actually a whole soy product and not soy protein powder or the Impossible Burger and all of the other ways that we're processing soy. For dopamine, then we're going to need the amino acid tyrosine for making dopamine, black beets, pumpkin seeds, sesame seeds, avocado, also so nicely dark chocolate and coffee are rich in tyrosine. So for our micronutrients, what's important, these micronutrients that are on the left there are the ones that are important for neurotransmitters. B6 is important for making serotonin. B12 is important for SAMe, which is S-adenosylmethionine, and that is important. If you look at all of the various pathways, SAMe can be made into dopamine, it can be made into norepinephrine, it can be made into serotonin. And then magnesium and zinc are also important cofactors for those things, as well as GABA, which helps us for anxiety. So what are the micronutrient-rich foods? There they are listed. I don't need to read them to you, but I would like to say something about B12 deficiency. So because if you recall from your biochemistry, B12 has a very limited and complicated absorption in the human body. And so we need acid in our stomach. We need transportation across a very small area of the small intestine. And we also need to be getting exposed to quite a bit of animal protein. So if we're eating a vegan diet, if we have had gastric bypass surgery, if we are on chronic PPIs that reduce acid in our stomach, if we're on metformin, if we are getting old, we often have B12 deficiency. The integrative psychiatry and sometimes all psychiatrists would say that a healthy, robust B12 for mood should be over 400. So if you see the range of 180 to 900, if you have someone who's very depressed and their B12 is 220, they might benefit from a little bit of B12 supplementation. And I always replace it with a sublingual B12 because of this absorption issue. And there is some theory like, well, if you just take some extra capsules of B12, again, we have all these rate limiting steps from our digestion for absorbing B12. And so particularly for people who are already eating animal protein, they will get absorption through the mucous membranes of their mouth, and you don't have to worry about, I've started a supplement, is it going to work? Because if they use a chewable tablet or a spray, their B12 levels will go up. And by the way, when you're checking B12 levels, if people are on a supplement, it will artificially increase their level. And then people say you're getting too much. It's like, no, you're not getting too much. You're taking a supplement. So please have people stop any supplements with B12 5 to 7 days before they get their labs done. And you're going to have the most accurate lab if they're fasting. That's not quite as important. All right, so let's talk about styles of diet. I'm going to start by saying something about whole foods, which is a little further down on the slides there, is that whole foods meaning it's as close to how it came off the plant or it came off the animal than if it came out of a box or if we put it in the box as the whole food. And whole foods are more than just the individual nutrient, right? And so there is a synergism that whole foods have in the food itself, as well as when we pair foods. So for instance, rice and beans are going to give you all of the amino acids that you need that are essential amino acids. So it's, to me, like no surprise that wisdom of our ancestors have created a diet that actually is what our body needs. There's also some appreciation that whole foods have many prebiotics with them in them that may help with gut health and the microbiome, and I will comment about what's being called the microbiome in a moment. So the thing to know about the Mediterranean style diet is that it's not a specific diet plan. In fact, it's more about what foods not to have than what foods to have. And it's a collection of a style of eating as well, actually, for the Mediterranean diet, having to do with some cultural components of community. But there was a landmark study. It was a 5-year study in Spain. It looked at the eating patterns of 10,000 people. And they were following the Mediterranean diet, and they had a 50% less likely incidence to develop anxiety and depression. And there's also other studies that are showing that these dietary patterns reduce the symptoms of depression, aside from just being better quality of life and health in general. The other style of diet that I often talk to people about, because sometimes when you say the Mediterranean style diet, that seems a little overwhelming, is what would be called a low glycemic load diet. And this is just helping to keep blood sugar even. As we all know, when glucose spikes, insulin spikes. When insulin spikes, we can get a stress response, which can deplete our neurotransmitters. It can aggravate our symptoms. And so by keeping glucose levels even, that can be very helpful. It can be helpful also for our metabolism and our weight, but specifically for our mood and with regards to this talk. And there are many people who have glucose dysregulation coming in. And so the way that we have a low glycemic load diet is having a balance of protein, healthy fat, and complex carbohydrates, and minimizing the starchy carbohydrates and sugary foods. And in general, there's quite a bit of data that shows that cultures around the world who consume whole, non-processed, unadulterated foods are healthier and their mental health is better. So this is a really, oh, I didn't advance you. That is a really helpful resource. You can download the PDF. You can put it in people's AVS. You can pull it up on your computer screen and show people. This is from the Harvard School of Public Health, and they call it the Harvard Healthy Eating Plate. And it's an adaptation of the USDA eating plate. A big difference being that there is water there instead of milk, because there really is no good data that we need to have dairy in our diet once we're adults, and the dairy industry just has a big lobby. And it also actually makes a comment about healthy fats. So what I often say to people, I call the trifecta of eating, is every time you eat, half the plate is vegetables, you have a protein and a healthy fat. And I like to emphasize the vegetables because people often say fruit and vegetables together, and people are primarily having fruit and not vegetables. That is not going to help them from a low glycemic load perspective, and it's also going to be missing some of those micronutrients that vegetables have and fruit does not have. So this is a really helpful sort of basic resource for people. Just a little addition about ancient wisdom. No studies attached to this one, although I believe they exist. I am not an expert in Ayurveda. Ayurveda is a form of medicine that came out of India. It's over 5,000 years old. But this is also sometimes a little tool that I use just based on people who are just overwhelmed. And again, you have to start with where people are. And so Ayurveda divides these sort of styles of what your constitution is. They're called the doshas. And the three primary doshas are Vata, Pitta, and Kapha. Vata is that very anxious, they talk about a willow tree that's being whipped around in the wind. And for that, just favoring warm cooked foods. Pitta is that much more irritable, agitated depression, and cool foods, not temperature cool, but not spicy, things that are cooling to our system. And kapha would be that very sluggish, I don't want to get out of bed in the morning, and I'm tired all the time. And that would be more of a really doing a plant. And we use the term plant forward diet rather than plant based, right? Because then people feel like they're limited. Plant forward, just always thinking about, are there plants in my diet? Okay, as promised, the microbiome, and let me make sure I'm on the right, as this one I have some extra notes. So there is this notion of a leaky gut. People maybe heard about that. And that is talking about a disruption or decrease in function in the gut barrier. And, conventional gastroenterologists now also agree with this notion of a leaky gut. And it is linked to exposure to antibiotics for sure, but also a poor gut microbiome from a diet low in fiber and high in saturated fats and refined sugars and artificial sweeteners. So as Americans, we have a high risk for having a compromised gut microbiome. And there is some data showing that emotions and regulations of emotions do seem to be related some to the gut microbiome. Now, what we don't have the data for yet is, okay, if we do something, can we give a probiotic? If we change the diet and we change the microbiome, can we show that it changes people's mood? We don't have that evidence yet. And of course, there's billions of different bacteria, and although we have certain species for which we are associating with certain health conditions and health things, we do not have specific microbes that seem to be linked to mood. So this is, again, just more, in my mind, supportive evidence of how important the nutrition component is here for our mental health, because the microbiome is affected by our nutrition as well. And a large portion of serotonin is produced in the gut, which also seems to be related to microbiome. Okay, a word about psychotherapy. As I said in the beginning, psychotherapy is with antidepressants is kind of the mainstay of treatment for conventional mental health treatment. And I just want to say that my observation is that a lot of times in primary care, people forget about the psychotherapy piece. And now that there is such a crisis, not only for primary care, but for mental health practitioners, that it's daunting to even think about, well, I'm going to recommend this to my patient, but nobody has any room. So I want to put in a plug for those of you who are part of Northgate and people who have behavioral health people in their primary care clinic, that they're a great resource. And they are not there for long-term psychotherapy, but they are there to help be a resource to get people started and to help them connect with community resources. So don't forget about it. And there are some people where their symptoms are not so severe such that really maybe all they need is psychotherapy, and that they don't need the attempt for symptom relief from a medication. The people who need that are the people who their symptoms is going to interfere with their ability to engage in the psychotherapeutic technique, or they can't wait for the amount of time that it takes for psychotherapy to begin to have some symptom changes. So think about psychotherapy before you think about writing your prescription, and at the same time as thinking about what's this person's nutrition like and are they moving. And I just wanted to mention that there are some very specific techniques. Again, many of our behavioral health people are trained in these, for which there is really good data of efficacy for helping with mental health problems. And beyond that, or within that, some of those things include these mind-body medicine practices. But I just want to define mind-body medicine is using the mind to directly affect the workings of the brain and the rest of the body. So we're accessing parts of the mind that the cognitive brain does not have access to. And a huge component of the emotional mind and that's in the brain that we know of, right? We really don't have any idea how the mind works. We think we do, but this is having access to these areas in our brain where emotions come from, where our thinking brain does not. And I give the example of, I can't just say, I'm going to go to sleep, and then I'm looking at you, and suddenly I'm going to sleep. But I can do some guided imagery techniques or some other kinds of meditations that actually do facilitate, when we do studies and the centers of where the sleep center is lights up, right? So we do have the capacity to access those areas using these different techniques. Mindfulness meditation, I will say a little bit about the science behind that. Mindfulness-based stress reduction technique, which is a very specific style, was developed in the 1980s by John Kabat-Zinn, who is out of the University of Massachusetts. It's an 8-week course involving about a 2.5-hour to 3-hour weekly session for about 8 weeks. And what he did was sort of secularize some of the ancient wisdom practices around meditation and some of these mind-body practices that were all sort of mostly from faith wisdom. And he secularized it and created these groups. And his original research, which was in 1982, came out, showed that when people went through this program, they had improved mood, reduction of psychiatric symptoms, and improved pain levels. And very interestingly, those positive responses sustained 6 months after the course, even for people who did not continue with regular activities that they learned in the course. Now, since the 1980s, and I have another slide that I didn't put in here because too many slides, the amount of studies that have been done around the efficacy of mindfulness practices for various things has increased exponentially. You know, like the 80s was here, and it's like up here for 2020 or whatever that graph is. So we just have a multitude of supportive data showing that these various mind-body medicine practices are effective. For guided imagery, sleep is a big one, and we know that sleep and our mood are affected, so really helpful for that with our data. Fantastic data around pre- and post-procedural anxiety, and it's a big study, I think it was out of Stanford, and there now is you can have a free guided imagery script that you can give to your patients that prior to surgery, people do these guided imagery, and they have shorter hospital stays, better pain management, and less anxiety before and after when they do, just listen to this recording. Acupuncture, we have a tremendous amount of data around pain management, but there also is data around anxiety and mood, really very useful. And I only sort of stuck it, it's really way more than mind-body medicine, but I put it on that slide. Yoga, there is really good evidence for both depression and anxiety, for both monotherapy, just doing yoga, versus also adjunctive therapy in people who are on medication. All right. Now we'll get into supplements. I leave them for the end because they're not the most important. So I'm going to hopefully in the next 5 minutes or so cover these 5 supplements to talk about. If I can find my extra page here. Where is it? Okay. So 5-HTP is the first one. 5-HTP is a metabolite of tryptophan, and as I said, tryptophan is the step for making serotonin. And what happened to my other slide? L-tryptophan has a rate limiting step. And so we used to use L-tryptophan many, many years ago, like a long time ago, probably before most of you were practicing. And it was mostly used for sleep, some for mood. And then there was this finding that people were having leukopenia when they were on tryptophan. And we were like, oh, tryptophan causes. And it turns out it was a contaminant in the way it was made. And so for a little while, there was like one company, it was the University of Michigan made L-tryptophan, and that was the only one that was approved. Everything else was banned. So the same thing happened briefly with 5-HTP. So good quality product is really important. But it is important, it's better than L-tryptophan because it bypasses this rate limiting step. And basically it is similar to the idea of an SSRI in that it's basically saturating the pre-synapse with a lot of what is needed to make serotonin. And so then serotonin can just go whoop right through there. And it also can increase the levels of melatonin, dopamine, and norepinephrine. But we have studies showing that you can get serotonin syndrome from too much 5-HTP. There's that big range there. The standard dose is around 100 or 150 milligrams. But you need to be very cautious if someone's already on an SSRI. And so some people will go and they'll buy some supplement for their mood and they're already on their fluoxetine. And sometimes that's not such a great thing for them. So you have to be cautious about that. And in the same way that if someone has bipolar disorder with any kind of hypomania or mania, we don't usually give them an SSRI. You also would not give them 5-HTP. So 5-HTP, in my opinion, is something that really you want the guidance of a clinical practitioner using it. And my pet peeve of people getting advice from the clerk at the health food store, this is one for why I have that opinion. Some of the data, again, showing that it improves depression, comparing it to other pharmaceuticals of SSRIs. It can be used as augmentation, but I usually save that for integrative psychiatrists. Like I don't usually add 5-HTP if someone's already on an SSRI. I will sometimes do it if they're on a different antidepressant. One of the best things that I think of for primary care people who are not integrative medicine specialists is you have your patient who's like, yeah, my sertraline worked really well for me, but I had such terrible constipation, I just could not take it. Then they might really benefit from 5-HTP. Or I tried all the SSRIs and they help my mood, but they all have too many adverse effects, 5-HTP. The converse, I tried all these SSRIs, they don't help me. 5-HTP is not what I would suggest for the person to try. It probably isn't going to help them. Vitamin D, again, this is where some of the mixed data gives us a lot of confusion, but we know for sure that if you have vitamin D deficiency, depression can be a symptom of that. There was this whole thing about what came out, it was in the USPS task force came out about their opinion about vitamin D in 2021. And people said, see, they said, don't test for vitamin D. But in fact, what they said was, don't test for vitamin D in asymptomatic individuals. And then they also said, if people have symptoms of some kind of deficiency, test their vitamin D. There's no harm in doing that. And we also know that if people have deficiency and we treat them with vitamin D, sometimes their symptoms get better. So don't forget that. Here we are in the Pacific Northwest where probably 50% of us have vitamin D deficiency. And again, remember about absorption as a fat-soluble vitamin. We are maybe going to need to use drops under the tongue for people who are obese or have had some kind of surgery because they might not absorb their vitamin D. Saffron, beautiful saffron. Great data, but small studies, mostly coming out of Iran, for depression and anxiety and sleep. Also, nice data about it helping with sexual dysfunction that people have as their adverse effects of an SSRI. I actually had a medical student on a day that I had a patient who came back who was wanting a vaginal estrogen because she was having sex again because she took saffron, because she was not having sex because her SSRI was making her libido poor. And so the medical student was like, what? The limiting thing with saffron is cost. It's expensive. What's the data? It takes 75,000 blossoms and 225,000 hand-picked of the red, stigma, to get a pound of saffron. And some of these supplements will use other parts of the plant as well, but that beautiful red stigma is what has the most medicinal properties. Fish oil. Fish oil gets a bad rap because we have all of these mixed studies, and basically it helps with depression, or it can, and it definitely, there's really good data that it helps as a adjunct therapy. And it is a particular form of omega-3 fatty acid, the eicosapentaenoic acid, which is EPA. And so I even have a dot phrase that says that it's not the dose of fish oil, it's the dose of EPA. And that's a pretty high dose of EPA, so you get a more concentrated fish oil so people aren't having to swallow too much. And the best thing for people to know is if you keep it in the freezer and you swallow it when it's still frozen, you don't burp it up and you don't get diarrhea, and it makes it usable. A lot of people are saying, oh, you can't take it if you're on an anticoagulant. You can't, if you're going to have surgery. A lot of those are theoretical risks. And really the thing is just to, if someone's on warfarin, watch the INR. It's really equivocal. Sometimes you need to change the dose, or people can't be on it. Most of the time, it doesn't make a difference. And then lastly, my favorite beautiful flower, passion flower. This is a lovely thing because it works so nice as a tea. It's not like you take your Ambien and you have to be laying down. When you take it, you drink your passion flower tea after dinner, and it really can help with sleep maintenance and sleep initiation. It can help with anxiety. There's good data, again, about using it before procedures. I usually prescribe it either as a tea or liquid extract. The liquid extract, then you can titrate up and down how much you need. It's great for people who are on other medication and they just have moments during the day where they're very anxious and they just do a little sip of their extract in water, and it can be very calming. It's also great for people who have performance anxiety. I take it. Okay, so supplements are not helpful by themselves in the same way that medications aren't. So they're really helpful and can be a very helpful tool, either as monotherapy without medication or as adjunct, but we have to do all those fundamentals at the beginning. And also know I gave you some 5 simple ones. There are lots of combination ones that include B6 and B12 and those kinds of things. So summary, there it is. And hopefully the summary includes, some of the doses and things that if you are interested in doing those things, you have a resource for that. Don't send people to Target or Walgreens for their supplements. They should go to a co-op, or they should order from a reputable place online. And I am always more than happy to engage in any kind of questions people have. You can send me a MyChart message. You can send a patient to me, although it takes a little while to get in. You can stop me if you're in the same clinic that I'm in. So any way that you have a question of how you might use something, please feel free to reach out. And with that, I don't know if we have time for questions, but if we do, any questions?
Thank you so much, Dr. Bell. That was great. We do have a question in the Q&A, but happy to also take questions in the room. Let's take one from the room for start with.
Thank you. Son. But anyway, so I'm wondering about geriatric population, same principles, with the supplements specifically. Any specific advice about people with dementia having agitation or sleep disruption? Any experience with that?
Yeah, I think that for people who have dementia who also have an older body, so not a young person with Alzheimer's, it's a little trickier. I think that passion flower, I don't really know about saffron. Passion flower and fish oil, passion flower may have a calming effect, but it's a little harder to get in because, if they don't want to drink tea or if it doesn't taste good. And the capsules, you can't titrate the dose, so it's harder to know. Fish oil is a great thing if you can sneak a little liquid into a little bit of juice, and that may just sort of have a general supportive effect. I think what works better for people with dementia is using essential oils and aromatherapy, which I did not mention today. So things like lavender essential oil, mint essential oil. There's a number of different things that can be calming, and there's some good data. A lot of the data actually, original data that is big data is from the Penny George Institute where I used to work, where they had did a whole research about using it on in inpatient floors, but particularly around postoperative patients for anxiety and nausea and pain. So that's probably what I would use more for a dementia population. In terms of just the elderly population, most of these things are not limited by kidney function. But in general, in the same way that you might start a very low dose of an SSRI or something like that, you would just start with the lowest amount and work your way up. And don't forget about nutrition, because a lot of elderly people are having, coffee and toast, and that's not going to help their mood.
There's a question here asking, frequently check and treat for vitamin D and B12 deficiencies, but on supplementation, vitamin D can be greater than 50, B12 greater than 1500. When do you get concerned? Assuming that the timing is correct.
So the UW lab was the first time I've ever seen a red high when someone was 51. It's like, hey, that's where I want it. And then you look down and it says, well, 50 to 80 is if the person is supplementing, which is true. It's very rare that you'll have a level that's over 50 if someone's not taking supplementation. But that's not too high. That's actually favorable. So you don't start to see toxicity until probably the earliest is 85, but it's usually in the 90s or 100. And believe me, I have seen people who have levels that, especially during COVID, that were scary high, and they get a kidney stone. There is real vitamin D toxicity, so you do want to watch that. But if you are under 80, then that level is safe. B12, very rarely people will actually have similar symptoms of B12 deficiency with tingling if their B12 levels are very high, but that's pretty rare. So I'm not usually worried about a high B12 level. And again, if you stop the supplementation or you make sure that it's a week or 10 days from when they've had their injection, you probably won't get as many of those high levels. You'll get a nice normal range of, 800 or something like that.
Thanks for a great talk. Two quick questions. One is just, does insurance cover depression as an indication for vitamin D testing? Because I know sometimes they really want to see sort of bone indications. And the second question is just any favorite brands that you recommend, because I feel like reputable could mean a lot of things.
No, I almost exclusively use vitamin D deficiency as my diagnosis, and I feel like I'm not being dishonest by that if it is someone that has never had a vitamin D level and they live here, or they have, browner skin. And otherwise, you look and it's like, oh, gee, your vitamin D level was 25 years ago. But I do usually use vitamin D deficiency. Brand wise, I would say if people are going to a co-op, then There's now in NOW and Jarrow. There's also some online. There's a company called Swanson's Vitamins, and there's a company called Vitacost that are online that have really nice prices, and it's all good quality.
Oh, there's a question here on what are your thoughts on ashwagandha? Is this something you use for patients? People are seeing a lot of questions about that.
Yes, ashwagandha is in the family of what's considered an adaptogen, but it can, meaning it helps the body adapt to the stress response. It is sometimes used for anxiety. I don't usually use it as a, personally, I don't usually prescribe it as a single choice for an herb when I'm specifically looking at mental health. It's a very nice component, and I also use it synergistically with other herbs. It's really great for perimenopause, for that irritability and agitation of perimenopause, so usually with other things. So yes, it's a good herb.
I have a question just around integrating this this practice in a primary care practice.
Mhm.
Your tips and tricks about that or resources?
Yeah, I mean, I think that there really is a spectrum of how much one wants to use. And one is you know, get little tips and you think, oh, here's a patient I'm going to try it with. And others are, there are some lovely online CMEs for specific things. The University of Arizona has a really nice one around mental health. I don't know if they still do it, but they used to have a whole conference for integrative medicine and mental health. So there are lots of really nice, both online and in-person conferences of ways to learn. We will hopefully continue to have opportunities through the Osher Center, the Osher Collaborative, which is all of the 10 Osher centers are mostly now focusing on community facing, but there are some things. For people who are really wanting to dig deep, there is an Osher Collaborative Faculty Fellowship. That's a year-long, very intensive fellowship, and then you're prepared to sit for the boards. And then there are 3-year fellowships that people can do.
I think we're just about at time, but we certainly can take another one. Yeah.
I was wondering regarding the age recommendation for some of these supplements, is there a consideration for being too young to start some of those in addition in starting with something like that versus doing an SSRI?
There is a lot around pediatric and adolescent integrative mental health, and there's a little bit of overlap, but there are some things that are not. So fish oil is probably the universal thing, but again, the dose would be lower for kids. And then there are some other things to be used. So there's plenty for integrative mental health for youth. Some of the specifics of this and the nutrition and exercise part are big. And certainly as a primary care person, the notion of helping people to get a healthy start, so working with families early on to develop a nice, healthy, nutritious pattern that is still enjoyable and tastes good, is probably the best thing you can do initially.
Thank you. I had one other question. It was regarding access to some of the information that you had. Are there templated smart texts or things that other providers may be able to add to after visit summaries?
Yeah, I have a number of different smart phrases around nutrition, mind, body, medicine resources, fish oil doses and stuff that I don't know that it's blocked for you to share. You probably go into my smart phrase, or you can just message me through Epic and I'll give it to you.
Thank you.
Well, thank you everyone for attending, and thank you, Dr. Bell, for your talk. Thank you so much.